as we know, no genetic test is ever perfect or absolute. So, it's one of the problems with this genetic testing is that we wish they could be predict 100% of the time what you're going to do when you make that decision to try a medication. The genetic testing is particularly useful for people who've been treatment resistant. But a lot of people do the testing at the beginning and don't wait until the patient is resistant before trying it. But, so often people want the test to be perfect and absolute. And obviously, no genetic test ever is going to be that way, given that environment influences genetic expression. And we have so many different variables to look at, which is why you're doing integrative psychiatry, to try to get at root causes of problems and not just looking at one test. You can see that the black line there represents childhood trauma and depression scores. So obviously, if you've been exposed to enough childhood trauma, your risk of becoming depressed at some point in your life is significantly increased over and above that of somebody who doesn't have childhood trauma. But now when you introduce MTHFR variants and have difficulty methylating folic acid, you can dramatically increase the risk of becoming depressed as an adult. This just illustrates, this is a slide I showed in the last lecture about really just summarizing the different genotypes, the two short alleles being the poor responders. Another significant thing with the when you have two short alleles, and they mention in here elevated, I don't have a cursor, so elevated stress-induced cortisol. So these people, it's worth thinking about doing something about their these people have the greatest cortisol fluctuations in response to stress when you see somebody with two short alleles. So I often think about using phosphatidylserine or something to help regulate cortisol levels. These ion channel variants are common across several different, as I mentioned, several different mental and emotional conditions. So here, some of the traditional ways, of course, to tone down that system is using heavy-duty mood stabilizers. So second-generation antipsychotics, lamotrigine when we have our bipolar 2 patients, lithium. But omega-3 fatty acids also tone down excessive glutamate activity, and so does N-acetylcysteine and magnesium. So magnesium, omega-3s, and N-acetylcysteine are all good at lowering excessive glutamate activities, especially in somebody who's not bipolar or not schizophrenic, where you really don't want to go to any of those heavy-duty mood stabilizers.